The quality section displays aggregated quality of care results for selected evidence-based process measures that are applicable to the peer group. These are process measures, that is, they're measured using administrative claims data, and most are nationally endorsed standards of care denoted by NS in parentheses next to the rule type, like HEDIS, for example, which has fully transparent measure specifications and documentation. The measures are grouped by specific clinical condition, in this case diabetes, and identify quality opportunities for the patients treated by providers in the group based on the episodes attributed to them. Patients meeting the criteria of each measure are counted as with compliance, and a compliance rate labeled as actual rate is calculated for the practice group. A peer group compliance rate for each measure is also calculated for all providers in the peer group. The ratio of the actual rate compared to the peer group rate produces the quality index for each measure. In this example, there were 196 diabetic patients attributed to providers at the practice location who met the diabetes measure criteria for at least 2 hemoglobin A1C tests in a 12-month period. There were 170 patients who were compliant. The actual rate for the practice was 0.87 or 87%. The peer group overall had a compliance rate of 0.78 or 78%. The practice group had a quality index of 1.12 for this measure, indicating a 12% better than average compliance compared to the peer group. The aggregation of all the process measures attributed to the practice group comprised the overall quality index displayed in the patterns of care section at the beginning of the report.